So outside of MIT, but closely linked to my work in medical device design, I've opened up an initiative along with some co-founders called Cambridge MedSpace. And what we're trying to do is build a community of healthcare visionaries to really enable early stage technologies and the companies that build them to get themselves launched upon the market. And I'm partnered with Zymedica, which is one of the biggest medical device design firms in the country, based out of Providence, to provide expert mentoring services and guidance to help these companies grow from, say, angel round of funding through to their Series A and hopefully merger and acquisition. A particular focus of my medical device work and those of the students in our medical device design class is really developing tools for the carers to provide better care. So how do we give surgeons better instruments to care for their patients? How do we make nurses' lives more comfortable? And indeed, how do we actually care for the carers? So an interesting field of research that's emerging is ergonomics in the operating room. And ergonomics in general in healthcare is well known, but specifically, high-value clinicians are getting hurt. And they don't talk about it because their focus is on taking care of their patients. But what can we do to take better care of them, to make them hurt less after a surgery, make them less fatigued, and help them focus better on the job at hand? So I'm also part of the founding team that helped build the MIT Tata Center. I did my postdoc with them and I served as the program manager, and I remain a mentor for many of the students in the program. And the focus of the Tata Center at MIT is graduate level research directed towards challenges experienced by emerging markets. So how can we use technology to improve the lives of a couple of billion people who are in countries that are growing actively and are deserving quality of life improvements, better products, better health care, better sanitation. So where can we tap MIT's vast technical talent to improve lives? So through my work with the Tata Center and through that of the students who I mentor, I've come to see and really understand the depth and the complexity of the healthcare challenge in emerging markets. And currently, large medical device companies, healthcare providers, are really able to touch only the needs of the Tier 1 hospitals. But there's a huge number of Tier 2, Tier 3 small clinics that are all looking to be supplied with good equipment and appropriate business models. So there's significant opportunity in the emerging markets, and I think we're only just scratching the surface on how we can provide the products and the services that clinicians in those countries need in the majority of their clinical settings to improve their patients' care. And the pressures faced in the emerging market are more than just cost. Many people say we need low-cost medical devices, but low cost with respect to what? Low cost for who? What we really need to do is deeply understand the performance requirements of that equipment and then design to those requirements. And those requirements are unique. We assume many factors when we're designing here in the United States and indeed in Europe, but I believe we have to really go into an emerging market with a completely open mind and look for the very creative solutions. And as we know, if we create a lower cost solution as compared to the standard of care here, but if we don't compromise performance, then there is a great opportunity to bring some of those technologies back to the United States, where we're seeing 20% of our GDP is spent on healthcare, and we know that we have to improve our efficiencies. So to give you one example of where care in emerging markets can actually parallel care in the United States, we're seeing a growth in the United States of minute clinics, so small clinics located in pharmacies that are efficient and accessible at hours when typical primary care physicians are not in their offices. People can just walk in, inquire about whatever discomfort they're feeling, and receive some level of care that's appropriate, as well as the option for a referral if necessary. And we're also seeing now in emerging markets, we're seeing similar small clinics starting to form, which are standardized in terms of operation, in terms of lab work, and they're beginning to serve underserved communities with better quality care than the village quack is able to provide.